Welcome, everyone. Thank you so much for joining us this evening. We're very happy that you took the time and came to join us this evening. We're very happy. Thank you.
Welcome.
My name is Andrea. I am the president of the Alumni Association, and we welcome you to our second event of the year. And this event is the impact of COVID in 2019 on social work. Hopefully there will not be an impact of COVID in 2020. Sorry, the impact of COVID in 2020. Hopefully there will not be an impact of COVID in 2021.
Yep.
I said that wrong. But there may be an impact of COVID in 2021. Anyway, we're very grateful to have a wonderful panel and moderator for you this evening. Prior to introducing the moderator, I would like to let everyone know in the chat there is a link to do a survey at the end of the event so that we can confirm what's working, what's not working, and we can make the changes we need to make so that everybody will be enjoying the sessions going forward. Coming up on November 30th, there is a session, and I cannot recall what it's called now, but I'll get that for you before we leave tonight. The other thing I wish to let everyone know, in addition to the link for the survey and the upcoming webinar, is that we'd like to start the event with a land acknowledgement, and then we'll move forward. So I wish to acknowledge this land on which the University of Toronto operates. For thousands of years, it has been the traditional land of the Huron-Wendat, the Seneca, and most recently, the Mississauga of the Credit River. Today, this location is still the home of many Indigenous people from across Turtle Island, and we're grateful to have the opportunity to work on this land, study on this land, and live on this land. We also acknowledge the City of Toronto as a traditional territory of many nations, including the Mississauga of the Credit, the Anishinaabe, the Chippewa, and the Haudenosaunee, I struggle with that one, and the Wendat peoples, and is now home to many diverse First Nations, Inuit, and Métis people. I also acknowledge that Toronto is covered by Treaty 13 with the Mississaugas of the Credit River. That's our land acknowledgement. So I'd like to introduce our moderator for the evening. And many of you may know Esme. To be honest, it was my first time meeting her this evening. But Esme Fuller Thompson has been director of the Institute for Life Course and Aging since 2016. She's a full professor with cross appointments to the Department of Family and Community Medicine and the Faculty of Nursing. She joined the Factor-Inwentash School of Social Work in 1995. She has published 150 peer-reviewed articles on the long-term health impacts of adverse childhood experience, grandparents raising grandchildren, social determinants of disability among older adults, and immigrant health. She has publications in the New England Journal of Medicine, the Lancet, American Journal of Public Health, and Social Work. Robert Wood Johnson Foundation, Retirement Research Foundation, Health Canada, the Commonwealth Foundation, and the Archstone Foundation has funded Esme's research. Esme's research has also had an influence outside the academic community. Her research on disability and poverty was discussed in Time magazine cover story in December 4th, 2006. On This Year in Medicine, her studies have been featured in all major wire services. I can't read that clearly. And in hundreds of newspaper articles on 5 continents, across front page articles in the Chicago Tribune and the National Post, and front of section articles in the Wall Street Journal. and the Globe and Mail. Esme's research was profiled in a television documentary on CBC, The National.
Mm-hmm.
Her research on the housing needs of American grandparent caregivers provided the background for testimony to the U.S. Congress. She held the Sandra Rotman Endowed Chair in Social Work from 2009 to 2019 and was the Anson Assistant Professor from 1995 to 2002. Esme is a fellow at the Gerontological Society of America. Forgive me, this is quite a bio.
Yeah, it's probably enough already.
It's beautiful. It's beautiful. It's worth knowing. It's worth knowing. We thank you very much, Esme. And I'd like to turn the microphone over to you. Thank you.
Thank you. That was very generous, embarrassingly so. Thank you very much for that kind introduction. And I'd say one of my most important contributions to the social work field has been the pleasure of teaching at the University of Toronto for 25 years. And many of you on this call, I've had the joy of teaching. So there is nothing more rewarding than working with such a dynamic bunch of people. And I find when I go out to hospitals or any kind of social service agency, I love to see our social work staff, our social work graduates playing such key roles. So thank you for everything you do day to day. And we're going to hopefully have some time at the end for you to share your opinions with respect to comments that you can send in that are going to be, Andrea's going to be monitoring those in the chat box. So I do want you to include some of your comments because you're out there, you're on the front lines, and we would love to hear more about how COVID's affecting you and your practice. I have the pleasure of introducing our three presenters today. So first of all, I'm going to start with Debbie Shatia. She has her MSW, she joined Covenantal House Toronto as the Director of Program Services just in the past March 2020, sort of that critical time. So the whole COVID transition, she jumped in with both feet. Prior to joining CHT, Debbie was the President and CEO of Youthdale Treatment Centers and the Executive Director and previously the Director of Programs at Turning Point Youth Services. Both were accredited children's mental health agencies. As a leader in the child and youth mental health sector, Debbie has experienced leading organizations that provide inpatient mental health services, residential treatment, and community counseling, youth justice programs, and youth shelter services, basically the whole spectrum of services. Prior to joining the youth mental health sector, Debbie worked for 20 years in the child welfare sector in progressive positions at the Children's Aid Society of Toronto. Prior to leaving CAS Toronto, Debbie was the founding director of the Child Welfare Institute. They do such wonderful research, so that's a real tribute. Debbie is a strong believer in engagement, collaboration, and partnership. She holds a master's degree of social work from University of Toronto. We're also lucky today to have Abby Katz-Starr with us. She was the she worked for the Ontario Public Service for over 30 years in a variety of different ministries, including the Ministry of Government Services as the Director of Corporate Policy, the Ontario Women's Directorate, the Ministry of Community and Social Services, the Ministry of the Attorney General. She worked also in the Office of the Public Guardian and Trustee, Family Justice Division, the Ministry of Long-Term Care, Health and Long-Term Care, as the Registrar of the Health Services and Health Professionals Appeal and Review Board. Abby has also served as a Chief Operating Officer for the Health Board Secretariat and at the Ministry of Public Infrastructure Renewal as the Manager of Gaming Policy. In October 2011, Abby was the director of the Retirement Home Project with a mandate to bring the retirement homes legislation fully into force and support the development of the governance and accountability structure to oversee the retirement homes regulatory authority. Abby then became the director for the Ministry for Seniors and Accountability, a newly created position in recognition of the increasing program and policy responsibilities related to the provincial response to the rapidly changing demographics. And certainly we've come to aware of our demographics, particularly in this COVID light. In January 2016, she took on the role of Assistant Deputy Minister of MSIA and retired from the Ontario Public Service in mid-2019. Abby has an extensive background in seniors issues, working in both institutional as well as community settings, as well as vast experience in organizational leadership, regulatory policy, corporate governance, policy development, as well as the strategic and corporate planning and reporting. Abby was appointed to her new role as Chief Executive Officer at the new Unionville Home Society, which is a residential and community service campus for seniors, in February 2020. Again, that transition at a key point just before COVID struck. And last but not least, we're so pleased to have Theo Adjei join us today. He kindly stepped in. John O'Mara couldn't come at the last minute. And I have to tell you, Theo was a former student of mine, and I'm very proud of all that he's done. He is an addictions and concurrent disorders counselor at the Toronto Harbour Light Ministries residential treatment program. He provides treatment and counseling support to clients in individual and group therapy sessions. Theo also supports clients on an outpatient basis through individual counseling sessions and assists clients with both housing and treatment referrals. He's motivated to support individuals in their recovery journey, but takes a holistic and solution-focused approach to support and accommodate the clients and their needs. So thank you to all three of you for joining us today. I'm going to start us off with a very big question, and I think I'll do it in order that I presented you. So the first question that I'm going to ask each of you one after the other is, what has been the main impact of the COVID-19 pandemic on the client group and population that you work with? So let's start with Debbie on that one.
Sure. Can you hear me?
Yes, perfect.
Yes. Okay, great. Thanks. So thank you for having me. It's a pleasure to be here. I would say, and actually I see that one of the Covenant House Toronto staff, Tajika, is on the line. So Tajika, feel free to interject at any point that you want to, because you have a much more frontline experience than I do and probably have a lot of valuable insight to add. So I'm not so sure how familiar people are with the services of Covenant House Toronto, but we do work with young people who experience homelessness, as well as young women who have experienced sex trafficking. So those are our two primary client populations, and we do offer a range of services. In terms of the main impacts, I see it kind of multi-tiered. And some of it sort of leads into some of the next questions, but for the most part, I would say that many of our clients have experienced significant isolation. I think we have definitely seen an increase, and most of this is not going to be new to you if you follow the news, if you're living in 2020, you will have experienced this and know kind of the impact on everybody in the broader society. So we're just dealing with a microcosm of that. However, we have seen an increase in mental health challenges for our young people, as well as substance abuse issues. For a period, I think we had a little bit of a lull when we had the CERB for many of our clients. There would have been a bit of a different experience for our young women who have been sex trafficked. We were on a call the other day with the Toronto Police, and the numbers of calls that they're getting has reduced. So what we're assuming with that is twofold. Either there's been a greater underground connection, or because of COVID, there hasn't been the ability to engage young women in the sex trafficking business in the same degree. And so there has been a little bit of a positive news story, if you want to say there, in that the young people haven't been able to be lured in the same way that they would have been pre-COVID. We do have a number of young people. Many of you would have read in the news about the hotel programs. Covenant House, in partnership with a number of other shelters, has hosted a hotel program in the downtown core as well. We have almost half of our young people in a hotel, and that was to allow for the social distancing. As people probably know, in shelters, there is a lot of room sharing that happens, and we couldn't engage in the social distancing. There was a strong movement against the city to say you can't have people who are living in the homeless sector who are on top of each other, which generally in the shelters they are. And so one of the biggest impacts probably is the reduction in access to shelter beds. So because of the social distancing in the youth shelter, overall currently and possibly going forward, we may have lost up to 100 beds in the youth shelter sector, and we were already full. For Covenant House, we run generally 94 beds for homeless young people, and we will be losing in the long run 11. With the hotel, we've been able to maintain stable numbers, but going forward, that will be a challenge for us. And so I think for our young people too, they would talk about lack of access to services and how hard it is to kind of find services in COVID and access the supports they need. We've maintained a lot of our services open, but for example, our drop-in center, which used to serve 100 young people, very, very compromised young people living with significant mental health challenges. And we've now, we had to close the drop-in center for social distancing purposes and everybody's safety. And we've since opened, but we're seeing now 15 a day. So just nowhere near the numbers of what we're seeing. And so those young people are either accessing services elsewhere, we're contacting them via WhatsApp or other resources, but they're not getting the same kind of support as they used to. I'm sure I could get into more detail, but I want to leave time for other people. And I think a lot of the questions will be answered in the next questions.
Fantastic. Thank you. Well, it was interesting to hear some good news story. I hadn't heard that. So that's nice to have at least one upbeat thing to think about. Abby, you're muted, but you're up next. Okay.
I'm muted. So thank you. Maybe I'll just start by quickly describing the campus of care. So we're in Unionville, and we have 122 life lease apartments. That's independent living. 160 bed long-term care home, as well as a geriatric outreach team. We have an adult day program and a seniors active living center. So it's a fairly broad range of both residential as well as community services. Of course, all the attention has been on long-term care. Again, if you even wake up in the morning and turn on 24, the first thing you'll hear is something about long-term care and COVID. It's been I had 3 weeks and then COVID hit. So it was quite the adjustment. And I think, we're very fortunate. Union Villa, the long-term care home, they are A beds. So that speaks to construction and meeting design standards, but essentially our primary accommodation is single rooms. So we don't have the same issues as the older homes that have been struck so badly. And where we do have double rooms, they're fairly large. And so we can maintain distance. Having said that, we've had some significant issues, certainly the first 3 months where we were in total lockdown, and we've been fortunate. We've kept COVID out. So we feel very blessed about that. But the kind of support services that our social work department, which is really a single social worker, again, the ministry in their wisdom certainly doesn't see those kinds of support services in the same way as those of us in the field actually realize the need for. We were in total lockdown, and our social worker was working remotely, which meant nobody's on the floor, nobody's interacting with the residents. It's all up to the nursing staff. We saw loss of appetite. We saw meals that were previously social activities. Family would be there, friends would be there. In fact, the loss of weight had has become quite a significant issue for residents in long-term care. And even now that we were allowing essential visitors, essentially one family member can visit, we still haven't been able to sort of overcome that particular issue for individuals. Depression is much greater. We try to avoid using medication as the intervention, but responsive behaviors have increased. I mean, it's just a lack of attention. It is the lack of energy. I mean, we try to keep music, and our rec staff do try to socially engage our residents, but it just isn't the same. You just can't keep the volume of activity. And it was a very lively home. Now that we've actually expanded our social work department by half a social worker, so we have another half time, and we are trying to engage the families. We're trying to engage the individuals. We're incorporating the nursing staff far more in the day-to-day, trying to observe what's going on the floors. So again, previously family would be there and they would see the minute change in behavior perhaps, or presentation, and we could intervene much more quickly. Often we're not getting to an individual till long after they're experiencing that their loss, and so many deaths that have occurred, and people are losing friends. So it's a very difficult environment. We greater number of falls are occurring. There's the increase in angry outbursts. Staff are exhausted. Again, we've been fortunate to have fairly strong staffing, but we rely on agency staff as well. We've been trying to increase our numbers so that they can take the place of family. But it is very hard. And I think the social work department has seen the most significant impact because they can't do the job that they're there to do. Support the family, support the residents, and support the staff. I mean, it is a three-pronged system that happens in there. So we know that social isolation is an underappreciated health risk, but it's certainly affecting the individuals as well. And again, we're fortunate to have strong medical team that is in there, where we've tried to keep up our care plans to keep families involved. But the stress is, it's wearing on everybody. It's wearing on everybody physically. It's wearing on everybody emotionally. We're trying to bring in grief counselors, but then a lot of people don't want to come into long-term care. And it's very hard to engage through Zoom to get that same sort of emotional connection. So anyway, I'll stop there, and I'm sure we'll carry on with more questions.
Right, thank you. That was a great overview. So Theo, you're muted as well, but could you just share a little bit about your location and also how it's impacting your clients?
So first off, I want to just say that John sends his regrets as working in the organization and being a part of the Alumni Association. I chose to step in. So the major impact in our organization being it's a 12-week residential treatment center, meaning our male clients, they stay there for up to 90 days. We've literally seen our program clients, get cut into half, right? Pretty much. We used to have up to 40 available beds, but due to COVID-19 and due to some of the city's health and safety standards, we restricted our program to about 16 clients in the program. So each client has their own individual unit. Part of that too is a lot of what we were doing to kind of support and accommodate clients have been restricted and limited as well. In-house, so a lot of the clients are mainly restricted to being indoors. They have 3 walks per 30 minutes, each walk per day, and you can tell that kind of has a bit of an impact on the clients as well. Fortunately, our organization, in terms of the residential center, hasn't been forced to close due to COVID. We've been COVID-19 free, and I would attribute it mainly due to our, community partners. So we work with Women's College. They, do a great job with our intake worker to get clients COVID tested and in our building safely. We have an isolation period of about 72 hours, which is about 3 days. So that is essentially one of the difficulties for clients coming in as well. Just being in isolation for that duration can be a bit impactful on their mental health. Our main focus is supporting them in their recovery and assisting them with, their mental health issues and struggles. So what I've been, hearing from our intake worker is the process to getting clients into our program has been a bit of a difficulty as well. Because some of the requirements that we have for clients coming in is that they have a certain period of sobriety time. And if they don't have a period of that sobriety time, we're asking them to go to other organizations for stabilization and sobriety time, specifically detox centers. Across the board, the addictions resources and services have been, limited and restricted in itself. So it's harder for individuals to find detox centers to, be admitted into. Shelter services as well is, limited for many clients, and other treatment centers as well. We're one of a handful of treatment centers that did have a shorter wait list. But due to COVID-19, our wait list went from 3 months to almost up to 6 months to a year. It's essentially a longer wait for clients trying to get into our program. And other alternatives are, outpatient supports, but we don't have an in-house outpatient program. So a lot of our services on an outpatient basis have been restricted to Zoom meetings and groups, which is, is a better alternative than nothing, right? So we do have former clients and clients that are wanting to get support prior to arriving to treatment, joining some of our Zoom meetings. I used to meet a lot of clients, on an outpatient basis in person, but due to COVID-19, that's been restricted to Zoom as well. And, it's a lot difficult for clients to follow up online as opposed to in person, which I found. So, just the stress and, the frustrations with getting, resources and supports has been something that I've seen. It has been a great impact on many, treatment clients, both inpatient and outpatient. I'll leave it at that.
Yeah. So you certainly see some themes across the different sectors, even though the sectors are so different, but the pandemic certainly has had an impact. But the next question, which I'd like the audience to be thinking of too, I'm going to come back at the end and ask and answer points or share comments that come up in the chat. But what has been the major impact of the pandemic on you as a practitioner? And I will do the round again. So Debbie, want to start?
Sure. I don't like starting actually. Anyway, but I will. You guys start. No, it's okay. I'm okay. What I would say, certainly, and I think I had been on like in between jobs, I guess, and started during COVID. And before I started, one of my colleagues who still works at the Children's Aid Society of Toronto said to me, every decision takes like 3 hours. And I was like, what are you talking about? And so I would say as a practitioner, I think we're more into a routine now, but at the beginning, certainly of COVID, and now as we're heading into a second wave, maybe again, everything is about crisis. Everything is about decision making. No decision is straightforward. You know, where does this furniture go? Have we socially distanced enough? People, can we have a visitor? Can we do this? Can we do that? If this person had contact with that person, can they come in the building? Should they stay off? So every decision makes your brain hurt, and is an enormous challenge. And nothing, I think we are becoming a bit routine. I would say the other piece for me is the challenge, and I'm an administrator, so I'm not speaking from a frontline practitioner social work perspective. I'm speaking as an administrator. The big challenge for me is how to keep staff motivated. I've been incredibly impressed with the staff at Covenant House Toronto. They, like everybody else has said, incredibly dedicated. They keep coming in every day, but you know they're exhausted. And, you know, you bring cookies and you smile and you visit. And you, in terms of how to support them, because they're exhausted, like everybody said, they're absolutely exhausted. And so how to support them and keep morale going. I think everybody in the world right now is thinking about the winter, particularly in Canada and Toronto. It's going to be a long winter, and that's everything people keep saying. Staff themselves are struggling with their own mental health, and so you want to be able to support them. We have also been short-staffed, so trying to keep staff pools engaged and motivated has been a challenge for us, and particularly as a social worker and in my role. And so I would say the other piece I was thinking about is, you know, when I got there, everything was COVID. I don't think I talked about anything but COVID. So clients, when you talked about clients, it was COVID and how to keep them safe with respect to COVID. And there wasn't a discussion about, you know, how do we improve services? Where do we go? What's our strategic plan looking like? And at one point, maybe a few months in, I met with the executive director, and he talked about the strategic plan and talked about future planning. And it was such a relief to actually feel a little bit normal, like we were going to talk about something other than COVID. And so, but it's that balance, I think, between trying to be normal, but recognizing that people are exhausted. I mean, there's a million projects we could be doing, but there's only so much people can kind of manage at this point. And so for me as a practitioner, it's trying to keep people motivated, engaged, thanking them for what they're doing, because it is an exceptionally stressful role that people are in. And so those are some of the challenges, and trying to stay focused on the positives and reminding people about the really good work they're doing and the difference they're making. One of the other challenges I would say is trying to foresee the future. You know, we're looking at a potential building redesign, and you're trying to imagine, are people going to be in the office, not in the office? Are clients going to be able to live more communally, not? What does 5 years down the road look like? And when you're trying to do future planning, but really can't see beyond the end of the year, that's a really challenging thing to do. So I'll end there as well, just as my thoughts for now.
Okay, thank you. That was a good overview. Abby.
I'd like to say ditto and just carry on, because some of the issues are the same, but I think we don't have a choice about being present. I mean, long-term care is 24/7, and it is always happening on the premises. So there's a small group of staff, of admin staff, including our social work staff, who can do some work remotely, but we are full-time, full-on, physically present. And I too am speaking from an administrative perspective, trying to figure out how to keep my staff motivated. I had 3 weeks. I remember when I had my interview, I had my first 100 days, all the things I was going to accomplish. I was the third CEO in 2 years, so there was a lot of expectation when I came on board in terms of building the team and rebuilding stability. And then COVID hit, literally. The fourth week I was there, and we actually went into lockdown before the government suggested that was the way we should head, because we could just see where this was going. We've had experience with flu outbreaks, so there was a little bit of an understanding. I don't think anyone contemplated the seriousness, certainly at that point, but I think we got a bit of a head start. This for us is normal. There is no such thing anymore. We will never go back to visits from family 24/7. We'll never go back to people just wandering in and wandering out. I'm looking at now things like automating the screening process at the front, so that you don't get to walk in the door until you've answered the questions on, some kind of mobile unit. You get tested for your temperature. We're even looking at UV lights to sort of disinfect before you walk in the door. I'm learning about things that I never imagined I would ever shop for, UV lights and electrostatic disinfecting, but I have to demonstrate that we are keeping people safe, families, residents, and staff, because the staff go home to their families, and I'm responsible when they're there. So I feel like it's a much bigger burden than I anticipated. That somehow I feel like their health and safety sits at my feet, and making sure we make the right decisions and still keep normal. Normal meaning they eat and they laugh and they talk to their families through, we've gotten a lot of iPads donated and different tablet devices so we can Skype and FaceTime with family. I have to, recognition. Debbie, you mentioned that, very important. Staff need to know they're valued, and it's not quite enough just to say thank you. We have to do other things, because we're not letting them off the floors. We're cohorting them. So we're bringing meals to them, because they can't go anywhere to get a meal. They can't share a meal. We've got to sit 6 feet apart. Making sure, I'm buying container full gowns and gloves from overseas to make sure that we have enough PPE. So that the kinds of things I'm worried about every day get in the way of worrying about the things I should be worrying about, which are the people, and keeping them, engaged, and because it's their home. I'm in their home. This is where they live, and so I feel like I'm their guest, but I'm also responsible. It's very complicated. Not anything I expected to really have to lead, and then I have to keep my staff engaged and motivated, and feeling like they've contributed and they've actually accomplished something, and build a team. Forget about the fact that I've got a crane in my backyard, and I'm taking over a main floor of an affordable housing and building a brand new seniors community hub, and all the strategic planning that was supposed to happen. So it really changes the job you do, and it makes you value, a different set of I don't know, challenges that you need to overcome. So it's a new world.
Absolutely. It's a completely new world on all fronts, practice and family and life and the world. So Theo, could you just speak a little bit about how it's impacted you as a practitioner?
Yeah, I at first want to say that, I want to thank Abby and Debbie and, the administrative staff and management staff, because it is individuals like yourself that are making individuals like myself feeling very safe and comfortable doing the frontline work that we do to support clients. I would say, it's been a bit of a difficulty adjusting on the fly to new, organizational changes, but the process has been easier because of, our management and our staff at Harborlight. I feel safe going to work every day. I feel safe coming home every day because of some of those measures we have in place. Our clients would echo some of the similar things, even though we have a lot of restrictions on them. One thing that I get a lot is that they feel supported and they feel safe, right? Having a COVID-free environment really makes things work the way they need to work in this new norm that we're all experiencing. I wouldn't say there's any kind of counter transference on myself because the focus is on supporting clients as best as I can. But one thing I do feel is that with a smaller group of people that I'm supporting personally, it's a lot different, right? I went from supporting 10 clients to supporting 5 clients, and it's more of a personal approach now. One of the biggest challenge is keeping clients motivated and keeping clients present, just keeping them there in our residential center, because the alternatives is if they relapse or leave, it's a lot difficult, especially if they don't have housing or emergency plan that can keep them safe once they choose to leave, or if we unfortunately have to discharge them due to some of the policy pieces. I'm actually surprised at the amount of graduates we've had in our since COVID-19 has impacted our program. We have a lot more clients graduating, but it's a smaller client base. The important piece that I always try to focus on is after the 3 months. So it's an absolute priority to support the clients with any kind of resources out there post treatment. And the difficulty is there's not much in-person resources. So it's, having to kind of look into other kind of alternatives, either Zoom meetings for the clients, or, counseling supports over the internet for the clients, those things. Helping them reconnect with, safe supports is important as well. A lot of the clients can't see family while they're in our program. So that feeling of homesickness and being away from their main supports, often you find that drains some of the clients and causes the lack of motivation. So my biggest challenge is keeping clients motivated. But when I'm able to do so, you get a gratifying feeling from that. When you're able to impact somebody's livelihood in a positive way, it really pushes you to continue doing this work. So even though COVID-19 is the new norm, my work doesn't stop. Just like what Abby mentioned, we don't stop being social workers because of a pandemic. We continue to push forward and do our best, and our focus is to support as much people as possible. Right.
Well said. Well said. We're always, once a social worker, always a social worker, even if we can't have imagined where we'd be at this moment a year ago or less. So I have a 3-pronged question, and I'm going to start with Abby this time, just to rotate the first up. So what changes have been implemented to service delivery that had negative impacts, that have had positive impacts, and what do you think is here to stay? What that will, after the pandemic, we might keep some of these things going?
So I'll start with the positive. We have used technology far more than I think we've ever done so in long-term care, and I think that's a good thing. We've done it in a number of ways. We've improved our ability to communicate with our physicians through something called secure conversations. And so it means that they can actually see what the nurses are seeing and sort of get into the situation much more quickly, assess the situation clinically much more quickly, and perhaps we can avoid a transfer to an ED, which is highly traumatic, especially in COVID times. So that's really important, as well as I'd mentioned earlier, this social engagement piece. We are using digital technology far more. We're even looking at getting, the sort of artificial intelligence, so Alexa, call my daughter. So trying to install so family can actually speak to their family members without relying on an intermediary to connect them. So for that, it's just about money. So that's part of our fundraising. Hopefully our fundraising initiative will be to try and get those kinds of devices in order to give family more independence, or residents rather, more independence. What else are we doing that's new? I think all the recognition programs that we've introduced, they won't go away. And we've also created better partnerships with our union. So for the first time, I signed an agreement with our union that we will use progressive education as opposed to harsh discipline tactics. It seemed previously that it didn't matter what the mistake was, everybody went right to some kind of discipline, suspension, letter of warning. Especially in COVID times, people are tired. They're doing doubles. Things happen, mistakes happen. They're not intentional. They're not intended to harm. So we want to support our staff. And so we've created opportunities, as long as it isn't about harm or risk of harm to the individual. We've created new strategies that the staff are really responding to. And that also frees them up to actually tell us when they see an issue. They don't feel like there's going to be some kind of retaliation for raising concerns. And that's made a big difference. That won't change for us. The things that are negative, it's limiting family. That will not change either. We're actually looking at wearable trackers to give to families so that when we have to contact trace, we know exactly where they've been. Again, it's all about the money, but we have to start thinking very differently around our security. It isn't just about, cameras, catching, people who are stealing things. It's really about where have you been? Who have you talked to? How close have you been to people? So we're really changing how we're approaching what the next lifetime will look like. There is also greater recognition of the role of our social workers. I don't think anyone really valued in the same way as the absence has created an acknowledgement. And so the doctors in particular are really trying to engage the social work staff far more than I think they ever have. And they're seeing the value of the skill and talent they bring to help families understand and engage and make those tough decisions around palliative care and what to do if their family member gets COVID. And what are those decisions going to look like? And not just helping the family in the moment, but also after. So one of the other things our social work staff do now is they actually connect with family after death. So it isn't just, okay, resident died, put the file away. It's let's check on how the family is doing and how they're managing. And that's made a significant difference as well. So good and bad, we're moving forward.
Could I just ask you a little bit about advanced care planning? So the idea of, is that new to spend time with people asking what kind of interventions they want, do they want to have a ventilator, those types of things, or?
Well, I mean, it's, first you have to talk about what is advanced care planning, because there really isn't, what you're really talking about is DNR. Are you prepared to have DNR? There isn't.
Not resuscitate, just in case.
Yeah, do not resuscitate. So no heroic measures. What does palliative really mean? And whether or not a family member having to come to make that kind of decision. So when there's admissions, and that's the other thing I should mention, that we have 20 empty beds. We can't admit. So there's also the conflicts between public health, the LINs, and the ministry. And one of these days they might get together and have a conversation and decide that they'll have common direction. But the LIN will tell us we can admit. Public health will say no, you can't. We're in and out of outbreak all the time, even though we don't actually have anybody with COVID, because if you have a symptom, you're under surveillance. So symptoms of COVID mimic 1,000 other illnesses. And let's keep in mind, people in long-term care are not there because they're healthy individuals. They come in later, they come in their mid-80s, they come in much more sick, they are many comorbidities. So they're always coughing, or there's always a symptom. So we've got 20 empty beds. People are on crisis lists. and they're not coming in. So by the time they come in, they're typically already palliative. And so the decision even before they come in is, what kind of care do you want in the event that the individual begins to decline? Some of the bigger ethical issues that we have yet to really deal with are MAID, which is, so medical assistance in dying is a huge issue in long-term care. But worse than that is the voluntary withdrawal of food and drink, and how that impacts individuals. Very hard for staff to manage that, and families just don't know what to do with it. So I'm struggling now trying to figure out what our policy would be on how we support that, and that's the feelings around those issues are huge and strong. Family want their family member to live forever. Sometimes the family member says, I don't want that, I'm done. Really difficult situation for the social work department, and they are the ones who then deal with, their client is the resident. So that's whose interest they have to represent, or the POA. And those of you who work with families know that if you have one sibling who doesn't agree with another sibling, it is very difficult if they're not part of the POA, if they're not a power of attorney as well.
Right. Well, thank you. You raised so many issues. Debbie, I'm sure you can raise a few issues for us too.
Thanks. Actually, Tajika and I are just sort of texting in the background behind everybody's back, and a lot of very similar issues that, despite the population, despite the different environments, I think we're all struggling with a lot of similarities, which is interesting. I wasn't necessarily expecting them to be quite as similar. In terms of positives, let's start. No, I'm going to end with positives. In terms of some of the negatives, I think I talked about the morale issues, substance use issues, increase in mental illness. I think one of the things I've noticed that certainly took place before the pandemic, but maybe has been exacerbated a bit during the pandemic, is that unfortunately shelters, both adult, I believe, and youth shelters, have become mental health facilities. And so we're supposed to be crisis beds for young people or for adults where they can come, have housing, and move on. But because we've become longer term stay places, and there aren't a lot of other resources available in the community, we've become more mental health focused. Most of our staff are child and youth care professionals. We have one social work, one mental health substance use counselor, and that's certainly been a struggle for us. We're looking at how we can add to or partner. I've been on the phone to CAMH and other mental health resources to see how we can partner with respect to providing the appropriate mental health supports. The ambulance today, I walked in, there was an ambulance at our door. There's police at our door. It's not, Abby, to your point, it's their home. And we try to be trauma informed, but sometimes the environment in of itself can be traumatic. And then you add COVID on top of that. And I think that compounds the experience for people within the environment. The changes, there's been a lot of physical changes. We're running a program out of a hotel. I don't know that any of us anticipated we would be doing that. And so those are some of the changes that we've experienced. As I mentioned, our drop-in center, I'm really struggling within the organization as to, do we continue to have staff in a drop-in capacity when we can't, maintain that, or should we be looking at outreach? What should that look like? How do we get to because the clients who attend our drop-in center are some of our most vulnerable. I would say also for me, I think Abby talked about the vibrancy of the place and trying to keep the spirit alive. And Theo, you talked about that as well. I haven't been at Covenant House pre-COVID, but my understanding is it was an incredibly vibrant place. You'd have donors walking through on a daily basis. You'd have volunteers. We had more than 100 volunteers. Now we kind of have 40 online. Our mentor program's gone online. And so the feeling of the place is not the same. It feels very, we can't run groups in the same way that we used to. There used to be groups constantly. And so, I'd love to have experienced what Covenant House would have looked like and felt like pre-COVID. And I think that's a change that's here to last for a long time. As Abby said, there's going to be some permanent changes in how people come in and are screened, people's feelings of safety, if you're not kind of, until it's going to take a long time for us to get back to normal. I think we all know that, to the way that we experienced life before. In terms of the positives, there's a few things I would say is that as a system, so we have a youth shelter interagency network, and we have networks that we work with in the area of sex and human trafficking, and we've become closer as networks. We're more collaborative than we were before. So the hotel program that we're running, one of the shelters that had to place young people in the hotel didn't have enough staffing. We said, we've got enough, we'll support you. They provide other supports to us. And so we've collaborated in a way that we've been forced to that has been positive. We've also collaborated with the city. The city's been an amazing partner with respect to, they're struggling themselves. I think they're working way longer hours than a lot of us are. But they've been an amazing partner in just trying to get us the resources that we need, both like the PPE as well as safe accommodation for our clients. And if we say, oh, we need this, they're trying to respond as best as they can. So there really has been increased partnership and collaboration. Technology, to your point, Abby, we've all been thrown in that world, and we've made advances in a way that we hadn't anticipated before. Who knew what Jamboard was before? Now it's like, an amazing tool that we're all using. I had written some notes before. Oh, one of the other positives is the hotel program has given us some new insights into potential future transitional programming for young people. And so we have found, we've carefully screened the young people, not perfectly, but carefully screened the young people who are at the hotel program. And so they would be a group who aren't experiencing quite the significant level of mental health issues that some of the young people we've kept at the shelter, or the same substance abuse level. And we have found that the staff there have been, again, like all staff, but they've been also an amazing group who've been a little more creative than they would have had the opportunity to do at the shelters. The rules have been a little more relaxed, and we've had young people say, you know what, this has given me an opportunity to see I can move out on my own, and I can be independent, and I have those skills and capacities. And so we've, out of our hotel program, which is about 38 young people that we're constantly full, but we've had 38 in the hotel. We've placed at least 28 in permanent housing. So it's given them that confidence to say, I'm ready to do that. The city has provided subsidies, monthly subsidies that will last for about a year to support that. And so there's a really promising practice emerging as a result of the hotel program that I don't know we would have had any other way of testing it. And we are trying to research and evaluate that and determine what, how we can use that to lobby the city in the future for these kinds of programs. Yeah, and the other positive is just to see the, as I said, staff are getting tired, but to see their resilience and creativity has been inspirational, really, and the young people as well. What they've been able to do and their spirit and how they've been able to keep going despite the challenges we've seen for many of the young people. I won't minimize those, but there's also been inspirational moments as well.
Great, thank you. So Theo?
All right. So one thing I can say is one of the major negatives in terms of just the organizational changes is that the health and safety policies that were incorporated are pretty much dictating our program structure as well. So clients are having to adjust to new policies and expectations, like around the clock. Clients are required to wear a face mask throughout the building, and The only exception is when they're eating and when they're in their rooms, right? That has been a bit of a challenge for many clients to kind of abide by that policy and expectation. Daily, they're getting temperature checked. If there's any symptoms that the client expressed they're having, that puts us in the position to assess that. We have an in-house nurse as well as two visiting physicians to determine whether or not we need to isolate them and get them COVID-19 tested. The great thing is that we do have an amazing partnership with Women College that is able to kind of support us in getting clients tested fairly quickly. But those isolation periods are a bit difficult. I wouldn't say a bit, very difficult. Most clients will tell you that being, restricted to their rooms for 72 hours can be very triggering, especially clients that have experienced things like imprisonment or moments of isolation. So those things can really impact their well-being mentally, and it can cause an increase of triggers as well for substances. We went from being a program that gave the clients a lot of freedom to be out and about. They would have the opportunity to be out all day on the weekends, and they would have hours for the weekdays after our programming ended during the days. Now they're only restricted to 3 30-minute walks per day, which includes the weekend. They aren't permitted to go visit their families, which was something that they were permitted to do before, and families can't visit them. So there's the only restriction. The restriction is that they have to, abide by that. If we find out, unfortunately, they have breached that policy, we put them back into isolation and get them COVID tested again. So that takes them away from programming and getting the psychoeducational benefits. Another challenge I would say per se is just staying motivated, knowing that there's a pandemic going on, essentially, right? A lot of clients who experience anxiousness and depressive disorders often feel the drawbacks from COVID-19. So just helping them stay grounded is something that we are finding as a bit of a challenge. But one thing I could say is that we have less clients, so that allows us to have more of a personal approach. Much of our focus is on safety planning. And one thing that we're doing more so often is connecting them with resources as soon as they step in the door, if they need resources or if they don't have resources coming through the door. So we have a great relationship with other organizations, transitional housing supports, and if we're able to kind of make the referral as soon as they arrive, chances are they're able to get some transitional housing. Another perk we have is we have our own in-house transitional housing program. So clients who have no housing are eligible for that, pending they complete the program, and there isn't any concerns or any restrictions on them residing on our transitional housing side, and that's up to 12 months. So with COVID-19, on their end, there's been a slower process for getting their clients from the community in. So that gives us the opportunity to make that referral. So that is a benefit in itself, having a transitional housing program. One thing I could say is that, for on the staff end, we have to get more creative, because essentially, activities are very limited. A lot of the clients, they're restricted to reading books, doing some CBT journaling, and playing game and watching TV for the most part, aside from getting their walk breaks. Before, they used to be able to go to the local gyms, exercise, But with COVID-19 and everything being closed, it's a lot different for them, right? So we have to get creative on our end. We offer yoga. That's something we also offered since, you know, the program started, but that is pretty much their only physical activity routine that they get throughout the week, and that's once a week. So thankfully, we have a lot of yoga mats in our building, and clients are, you know, doing physical exercise in their rooms. And we have a big sanctuary gymnasium that they can, you know, take walks in the gymnasium. I would say, yeah, with the groups that we have, they are becoming more hands-on and more creative, as opposed to just solely focusing on providing psychoeducational information, because of you know, COVID-19 and having less clients. We're finding that we have to place more focus on, you know, taking this type of approach. And that's been very beneficial. We clients are, you know, on board with journaling, learning how to, you know, develop healthy coping skills, and learning how to build that resiliency and tolerance. When they step outside, we're in an area that Jarvis and Queen, that there's a lot of triggers they're presented with. So one thing I am noticing, that a lot of our clients are able to utilize some of the things that they're learning in our program, you know, and activating strategies to stay safe out in the community, and keep themselves, you know, drug free and you know, sober, and you know, essentially working on, you know, improving their mental health. So that's one thing I would say that's been exceptionally great, that we have a lot of clients completing our program who are coming through the doors, you know, as opposed to, you know, when we had about 40 clients, we would notice that with more freedom to, you know, be out and about with, and, you know, present more, you know, risk and harm for relapses. We have a lot less relapses, surprisingly, in this COVID-19 period, which, you know, I think it goes to the programming, and it goes to, you know, just, you know, the assurance that they are safe in the building, and they have the supports they need in-house. But aside from that, I'll leave it at that, because, yeah.
Well, I'm so delighted that each of you have been able to at least bring some bright light to a very difficult situation. But what I'm asking you now, I noticed we haven't had too many comments in the chat. So up on the top right corner, you've got a view option. If you choose gallery view, you'll see all the people, well, you'll see at least half the people on here. And if you look at the bottom right, not the leave, don't press that, but more than 50 of you are on, there's a reactions. Do you see, everyone see that little reaction? So not at the leave on the bottom right, but a little left from that is a reactions, and you can put a thumbs up. So I'm just trying to figure out a little bit about who we've got on, which we'd normally just ask in person, but of course we can't do that now. So how many people are in the long-term care section? Can you put your thumbs up? Okay, Ellen's on. I see one. And how about how many people are in addictions and mental health? Can you put a thumbs up? Not seeing a lot. Okay, Elizabeth Lee, Samara, I see your thumbs up. Oh, Karen Wu, yeah. Okay, how about who's in child welfare, child issues? Okay, wait. Sometimes it takes a little while. Okay, Debbie, of course, I see. Altaf, okay. How about immigrant diversity kind of issues? Okay, what did I miss? I've only got about 10 of you. So on the right, just put in your chat, just throw in some of the areas that I'm missing, because that would be really interesting to see some of the areas.
Housing,
yes.
Healthcare.
Oh, I missed healthcare. How did I miss healthcare? Okay, healthcare, thumbs up for healthcare. Okay, emergencies. Here we go. Tony's in healthcare. Okay, how about students? It looks like we've got a good selection of students out there. Thumbs up for students. Okay, Kathy's there. Yeah, okay, Chuck, Sabrina, Andrea, great. So we're loving to see the students. Okay, legal, in the legal world, there's at least some. And okay, Nicola, great. How about government? Okay. All right. So what I'd love, and and there's obviously directors, administrators in all kinds of different fields. So Alex, yeah. Oh, I see, lovely to see old friends' names and faces, Jared and Judy. Okay. Now I have, if you can just throw in on the comments, one positive thing that's happened related to COVID, whether that's better recovery rates in smaller groups, whether it's learning a program that you can use with your clients in the future online. Is there anything positive? You can just put it in the chat. That would be great. I'm not being overwhelmed by numbers of you right now, but putting it in. All right. And then actually, let me just put a little plug in. I know that it has had a pretty serious impact on our students as well, because practicums are very hard to get in place. So if you know of any resources, or you can be creative in your practice setting to have students involved, we'd love to hear from you. All right, I've got a good, it just took people, oh, great, you're all typing. You just were slow typers. Okay, so positives were increased use of technology, more interest from government in affordable and social housing, and that came through with some of the discussion of transition, that's transitional housing. People say positives of doing my practicum from home. Potential virtual placements for BSW students. Rose is teaching up at Algoma and is one of our graduates from our doctoral program a few years back. Getting to learn from webinars like this that I otherwise might not have been able to attend. So we're so delighted that you can attend, and that 50 of you on a cold November evening are spending an hour and a half with you. We're very touched. Here's a student who's got a virtual practicum and it's still working for them. The ability to reach out and reach more people. Eleanor Silverberg's been doing some workshops for us at the Institute. Increased use of technology, able to reach more people. Access to cell phone, iPads, laptops for patients and clients, which in long-term care has been a huge lifeline. So that's fantastic. And a great comment, I've been here 25 years, but it increased conversations about integrating systems. We're all so siloed, and we really need to come together. So it's fantastic to hear these positives, and we thank each and every one of you for what you're doing to make the world a better place and to help us through the pandemic. The clients really value hugely having you, many of you on the front lines, and we thank you, and stay safe.